Okay, so today we're going to talk about Braden and his history, his background, and some things that might have to do with a swallowing disorder. So I'm just going to take some notes as we go, just to make sure that I have all the details that I need. So what's Braden's date of birth?
July 15th, 2008.
Okay. So has he been hospitalized, or has he had any major surgeries
No.
to date? No? Okay. Any allergies?
Mm-mm.
Okay. What about any current medications that he's on? No? Okay. Has he had any brain injuries? Traumatic brain injuries? No. Cardiac problems?
No.
Seems like he's pretty healthy, so. Okay, what about pneumonia, asthma, bronchitis, anything like that?
He had bronchitis twice.
Okay.
Once when he was 1, and again when he was like 3, but he hasn't had it.
Okay, gotcha. So bronchitis at 1 and 3, and it doesn't seem to be a problem recently.
No.
Okay. Does he have any reflux?
No.
No. What about any weight? Are there any weight concerns that you have for him? Or
No weight concerns.
he had some constipation? Is that what you're saying?
He did, and the doctor had him on a stool softener diet for 6 months, and he's still on it currently.
He's still on it currently.
Yeah.
Okay. Has it affected his eating habits at all? Is he eating anything different?
He still eats the same, and I don't consider it a medicine or a prescription. It's over the counter, and I'm not exactly sure what you would call it.
Okay, just an over the counter like stool softener, just to make his constipation more regular.
Right.
Yeah. Okay. Does he see a dentist? Do you have any dental concerns? Or
no.
Okay.
He's never had any cavities.
No cavities. Perfect. And he sees a dentist once a year? Is that okay? Has he had his hearing evaluated? I think they usually do that in kindergarten. I don't know.
I'm sure they have, but not that I can remember. I mean, I knew that they did it when he was born. And
yeah.
I would assume they do it at school when they do the vision test.
Yeah.
I haven't heard anything.
But has he had any issues
No.
with his hearing? No. What about vision concerns?
No.
No vision concern. And then developmental milestones. Did he walk, talk, everything kind of on time? Any delays? Okay. Perfect. What about his communication skills? Does he seem to be a pretty good communicator when he needs things? And
to
school?
Me, yes. At school, yes. But if he's with me to a stranger, he's very quiet.
Very quiet.
Shy, but it's not. Other than that,
yeah.
It's not that he can't communicate.
It's just his
shy.
personality.
Right.
Yeah. Okay. So current feeding methods. What are his preferred foods that he likes?
His proteins are like meats are what he normally eats the most.
Yeah. Okay.
Ever since the constipation issues, we've been trying to eat healthier foods.
Yeah. Okay.
So put more fruits in his diet. He's better at trying new things lately than he ever was. So.
Yeah. I mean, he's a kid, so obviously. Let's see. Are there any textures he doesn't like?
Is broccoli a texture?
Broccoli.
He does not like it. But no, I don't. Texture, I think it's more flavor than texture.
More flavor, yeah. Okay. Length of current meal times. How long does it usually take him to eat a meal? Like
10 minutes. Not long.
Okay. He eats it pretty quick then, huh?
Yeah.
So any pediatrician concerns about anything besides the constipation issue? Okay. So I think that's all I have for you. And next, I will grab Braden and we'll start with a general observation of how he looks like he's doing. So, all right. Hi, Braden. I'm Kristen. I'm your speech pathologist today. So we're going to just check your swallowing and make sure everything's working correctly. So first, what I'm going to do is I'm just going to check inside your mouth and make sure your teeth are looking good, and just to make sure you don't have anything hidden in between your gums. Did you have a good day at school today? Good. I'm going to put some gloves on. We can check in your mouth. Alright, so if you can stick your tongue out for me, I'm just going to look in that mouth. Great. Just going to check your teeth all around. You brush your teeth? Yeah. You just look in here. Say ah, put your tongue out. There you go. Looks good. Keep brushing those teeth. Just gonna feel your neck, make sure everything looks great. Looking good. I'm gonna check how your muscles are moving. So these are your muscles of facial expression, cranial nerve 7. So go ahead and smile real big for me. Good job. Go ahead, do a frown. Frown like you're sad. Good job. Go ahead and pucker out your lips like this. Good job. And then next what we're going to do is you're going to puff your cheeks out like you're a fish. Now keep the air in there. Don't let the air out. We're going to make sure it's in there still. Good job. I want you to next, you can let go, release the air. Good job. Raise your eyebrows like you're confused. Your mom's asking you to do something and you're like, what? Good job. Just see. Go ahead, raise your eyebrows again. Good job. Now what I want you to do is squint your eyes like you're looking at the board and you can't see what your teacher's writing. Shut them as hard as you can. Keep them shut. Just going to check your muscles. Good job. And then wrinkle your nose like you smell something funny. Like your brother pooped. Good job. Okay, now what you're going to do is clench your teeth really hard. Clench your teeth like, good job. Just going to check here and here. Both those muscles to make sure they're working good. Great job. Now you can relax. Go ahead, relax. Great. Now open your mouth. Open. Now try and keep it open. I'm going to push and you just keep it open. Good job. Okay, now close your mouth. Now try and open. Good job. Everything looks great so far. So now what I'm going to do is I'm going to measure from the bottom of your teeth to the top of your teeth. And we're just going to see how wide you can open that mouth. Great job. Put down. Okay, so now we're going to check out your tongue muscles. Make sure everything's working great. This is your hypoglossal. So go ahead and stick your tongue out for me. Now pull it back in and back out. Do it a couple times quick. Good job. Okay, now move your tongue, stick it out, and go side to side. Good job. Okay, good job. And now you're going to stick your tongue up and try and touch your lip, your top lip. Good job. And bottom lip. Yep, you got it. Go ahead and do it one more time, side to side, and touch, side to side. Now touch the inside of your cheek with your tongue. Push hard against there. Okay, other side. Push on there. Good job. Having fun? So next, what I want you to do is go ha ha ha.
Ha ha ha.
Okay, and then now la la la.
La la la.
And pa pa pa.
Pa pa pa.
Good job. And ka ka ka.
Ka, ka, ka.
Perfect. And now patika, patika.
Patika, patika.
Good job. Okay, now I'm going to put this in your mouth and I want you to say ah. Stick your tongue out. Stick your tongue out for me. Go ahead and say ah. Good job. Okay, and now go say ah for a long time, as long as you can. Okay, that's good. Now E, say E.
E.
Okay, great job. And then go A, B, C, D.
A, B, C, D.
Now go E, F, G.
E, F, G.
Good job. And then why don't you give me a good cough? Like you got something in your throat. Good job. Okay. Now what I want you to do is go ahead and swallow for me. One more time. I'm going to test how your muscles feel. So I am going to use this little cotton swab here and tell me if you can feel this. So top here, you can leave your lips regular. Yeah, just tell me if you can feel that. Can you feel it? What about here? Here? Perfect. How about here? Does it feel the same as the other side?
Yes.
Yes? Okay. Here? Okay. And here. Perfect. Okay, so now what I'm going to do is you're going to stick out your tongue and I want you to close your eyes. And you're going to tell me, I'm going to put a little bit of something on the side of your tongue and you tell me if it tastes sweet, sour, or salty. And this is kind of a little test. I'm going to see if you can get it right. Close your eyes, now stick out your tongue. What do you think it is?
Sweet.
Is it sweet? Okay, good job. You got it. Okay, open your tongue again. Not good?
Salty.
Salty. You want to drink the water? There you go. Okay. We got one more left. Okay, stick out your tongue.
Sour.
Sour? Do you like sour? Yeah. Okay. Everything's looking good. How's your smell? Can you smell everything pretty good? Okay. Now Perfect. We're going to try a couple different types of food, and we're just going to see how you swallow them. So first we're going to start with a thin liquid with your water. So go ahead and take one sip of the water. Okay. And now go ahead and take a few sips like you would when you're really, really thirsty. Good job. You can. Good job. Okay. And now we're going to put the straw in. And you can take a couple sips with the straw. And then take one sip and hold it in your mouth for just 1 second. Go ahead and swallow. One more time. Take a sip. Hold it in your mouth. Go ahead and swallow. Good job. Okay, so now we're going to take a bite of the applesauce. So you can go ahead and put a little bit on your spoon. Okay, go ahead. You can go ahead and swallow. Good job. Let me see. Open your mouth. Just check and make sure it's all gone. You're not hiding any in there. Good job. Okay, so next we're going to do a banana. You like bananas? Okay. I'm going to give this to you and you can go ahead and take a bite of that banana. Go ahead and swallow. Takes a little bit more to chew, huh? Good job. Okay. One more bite. Good job. Go ahead and swallow. Great. Okay, so the next thing, we can be done with the banana unless you want another bite. You good? Okay. So we're going to do chocolate chip cookie. Here we go. Okay. Job. You can take a sip of water if you want with the cookie. You're good?
Mm-hmm.
Okay. Just gonna check, make sure. Good job. Okay, and the next thing that we're gonna try is some cereal. So we've got milk, Honey Nut Cheerios. Okay, you want to take one more bite for me? Make sure. Good job. All right. Well, that's all we're going to do today. So thank you for sitting with me for a few minutes. If you want to eat the rest of your cookie, you can. I know. Braden's oral, motor, and physical exam, everything was within normal limits. There were no signs of aspiration. His nutrition looked good. His oral hygiene looked great. There are no concerns for dysphagia. The only thing that's a little concerning is he did have bronchitis when he was 1 and 3 years old, but that was quite a few years ago. So I don't think we really have concerns with dysphagia. So I did not recommend any kind of video fluoroscopy or any kind of instrumental exam, as I think all of his swallowing functions are within normal limits. I did let the mother know that she can contact me should she have any concerns or if his pediatrician has any concerns in the future.